Just some introductions first. So my name is Jonathan Morgan. I'm the chair of the Welsh NHS Confederation. I'm also the chair of Cwmtarth Morgannwg University Health Board. So it's a pleasure to see you all this morning, and a very warm welcome to my colleagues in the NHS who are joining us, along with our colleagues from our Health and Wellbeing Alliance. So thank you all for making the time this morning. Very conscious this is a very busy week for the Senedd, as it's the last week of term. And can I thank my colleagues for being able to arrange this breakfast get-together, minus the breakfast, and for all of us to spend a little time together hearing from the 8 political parties. So before I welcome our colleagues from the 8 parties, just to say that this event is built on the work that we've done for a number of years in pulling together a health and wellbeing alliance with over 70 members, with representatives from across the NHS, local government, healthcare, social care, patient organisations and professional bodies. The aim of the alliance is to bring together policy and public affairs professionals from across Wales to be a more collective and collaborative voice. There are established subgroups that enable more detailed conversations and to develop policy in particular health and care priority areas. I'd like to thank not just the team in the Confed, but all of you who attend those meetings of the Health and Wellbeing Alliance in the work that you've done in shaping a whole variety of policy proposals, which I know have been discussed with the main political parties. So this event today is taking place just before the end of term, before an election that will bring a significant change to the Senedd. And what I hoped today was that this would provide an opportunity for the health and care sector to understand the priorities of the 8 political parties and then run up to the Senedd elections in May, and for those colleagues to understand some of the issues that are affecting the health and care sector in Wales, and in particular the main themes which in our view need to be addressed once the election has concluded. So just a few housekeeping notes. I keep saying 8 political parties, it's 6. So sorry, I was just adding 2 in for good measure. So just a few housekeeping notes this morning. We will be recording the session so people can watch it back. Once I move on to our political representatives, they each have around 3 minutes to convey to you some of the key priorities that they are focusing on as individuals for their parties. And at the end of that, there will be plenty of time for colleagues to ask questions. At that point, I'll ask if you can just raise your hands in the normal way if you have a question to ask, and our Confed team will be watching the chat, and any questions may appear in the chat bar as well. So very warm welcome. Good to see you. I'm doing this alphabetically according to first name, so it means that we'll be coming to Anthony first. So before I come to Anthony for the first pitch, can I say it is a great pleasure to welcome Anthony Slaughter, leader of the Wales Green Party, Calum Higgins, Senedd candidate for Gaerfyrddin for Welsh Labour, James Evans MS for Brecon and Radnorshire and the health spokesman for Reform UK, Jane Dodds MS, Mid and West Wales and leader of the Welsh Liberal Democrats, Mabon ap Gwynfor MS, member for Dwyfor Meirionnydd and the Plaid Cymru health spokesperson, and Peter Fox MS for Monmouth and the Welsh Conservative Party health spokesman. So very good to see you all this morning. Very warm welcome to this event. And I'll now hand over to Anthony for the first pitch. Thank you, Anthony.
Thank you, Jonathan, and thank you for organising this and the invitation. I'm looking forward to a very good discussion, questions. I mean, it's undeniable that Wales needs a fundamental shift in how health is understood, funded and delivered to meet the challenges of inequality, mental health need, ageing population, and crucially the health impact of poverty and pollution. We're going to talk a lot about prevention. I think there's going to be a common theme across most of the parties here, and it's a strong element of our manifesto, which will be out in the first week of April. And our joined up approach will be built on clear foundations, clear foundations, healthier homes, cleaner air and water, safer communities, access to nature, healthier food, all of these things that everyone will agree do have long-term health impacts. If we can tackle some of these inequalities at root cause, that has implications for savings and future NHS funding, and a healthier population is what we must all be striving for. But now this is all very well, and I have this discussion in Green Party meetings as well. These things are all crucial and all things that we're committed to delivering and helping to deliver. But when you're suffering corridor care, or you're in A&E for 48 hours, or you're waiting lists, people talking about a healthier lifestyle doesn't help with that. So we do have to look at the structural problems as well that need to be addressed. And our manifesto, I'll just touch on some things now because we're going to have lots of discussion about this. But we're looking at things like implementing a long-term workforce plan to improve community of care and support, improve pay, job security and career progression, and strength and remuneration, all these things which are crucial. You know, we need to protect patient dignity and safety. We need to improve staff retention. Staff morale is crucial. And we also want to put a strong focus on primary and community-based care, bringing care and help back to where it's needed most in the community, trying to get rid of the silo approach where people go to one thing for this, another thing for that, and also effective and integration of social care. And this has to be more than just putting social care under the health boards. It has to be genuine integration, working together, because we all know that improved social care again reduces the burden on the NHS. So these are the angles that we're coming at it from after lots of consultations, lots of talking with various organisations that are represented here today. So, as I said, very much looking forward to your questions and discussing this further. Thank you. Diolch.
Thank you, Anthony. And I'll now come to Calum Higgins on behalf of Welsh Labour. Thank you, Calum.
Thanks, Jonathan. So I think it's important that Welsh Labour start off with looking at where we're at. We're obviously been in government for quite some time, and there's a context to that. So during that period, we've had policy of austerity from the UK government, limiting the funds for Wales to be spent. We've had a pandemic, amongst then the usual patterns that most Western democracies would see of an ageing population, and the challenges that brings to healthcare system. So in that time, you know, we've seen a lot of what's already been talked about by Anthony there, the shift towards a community agenda, a prevention agenda, changing the way you deliver health services, so investing in digital, upskilling the workforce. Many professions who are represented here will have different workforce challenges that they've been speaking to the Welsh Government around, and wanting to have upskill apprentices, have advanced consultant posts within their professions. All these things Welsh Government have been working on with the other UK governments on, trying to empower our NHS workforce. But the next step, the focus that Welsh Labour are putting on now, and the next step is this delivery agenda. So while we feel now we might have more funds coming, that we've got a more positive vision going forward, we need to focus on that delivery and be relentless about it, to bring down waiting lists, to ensure people do get timely and consistent care across Wales. And that fits in as well with the Labour Party's philosophy of equity and equality, that we ensure everyone gets those same services wherever they are in Wales. And we have built an independent health board system, which can sometimes be challenging in that regard. But the purpose now of some organisations which Welsh Government have put money into, including NHS Performance Improvement, is that we look at that delivery across Wales, enhancing what people see and get in terms of their services. And so, I can't go into detail on the manifesto because ours will be announced pretty soon. I'm not even sure I can give you the date, but I do know what it is, and it is soon. But we are, we've already announced a £4 billion capital fund for hospitals. And we want to see that investment in the infrastructure in the NHS as well as the workforce. So there'll be more to come, and I think there'll be common themes amongst parties around prevention and community service investment, which I think is the only way to go forward really in improving healthcare. Diolch.
Thank you, Calum. And I'll now turn to James Evans on behalf of Reform UK. Thank you, James. Good morning.
Morning, Jonathan. Thank you very much, and good morning, everybody, and thanks for having me. I think it's important to say from the start, I don't think none of the challenges we're talking about today are down to a lack of effort from staff. You know, people are working incredibly hard across the NHS, across social care, and across all the health disciplines. The problem, in my view, is the system itself needs fundamental change. It's under pressure because it's too reactive. We're too often dealing with people when they're already in acute need rather than treating them earlier. And what reform is proposing is to be a bit more honest about that and actually shift how the system fundamentally works. Yes, we need to bring waiting lists down because that's so important to people, and we've set out how to do that by increasing capacity with more diagnostic centres, more surgical hubs, using cross-border capacity where it helps, and there's representatives from powers here, making sure we fund that appropriately. And that's about getting people treated faster, but at the same time we've got to deal with what's causing those pressures in the first place. We take corridor care, it's not a standalone issue, it's a symptom of poor patient flow and delayed discharge. So if we want to fix it, we've got to expand step down care in our communities, improve discharge planning, and make sure that social care is actually working alongside the NHS. Because I know I've had casework, and many people have seen this when health and local government argue about where a patient is going and who's funding it. So I'd like to see social care and health brought more closely together. And there is a bigger shift for me. We've all talked about the shift left, and we have got to start moving more care out of our hospitals and into the community, because I think that's the best way that we can actually deal with it and bring care closer to people. Because if primary care isn't working and social care isn't there, everything ends up in our A&E departments, and that's what we're seeing across the country. So for me, the direction of travel, if we win the election, is simple: treat people earlier, closer to home, and stop the system consistently firefighting in certain areas. And I want to see a bigger focus on prevention. And I've said this before, it's that reprioritization of money into primary care and into social care. And I think that's how you start to take the pressure off the centre of the NHS in a really meaningful way. And I look forward to the wider conversations we're going to have this morning, Jonathan. Thank you.
Thanks, James. And our fourth speaker this morning is Jane Dodds on behalf of the Welsh Liberal Democrats. Thank you, Jane.
Yeah, diolch yn fawr iawn, a diolch am y gwahoddiad I ymuno chi y bore yma. Thank you very much for the invitation to join with you this morning. Let's just look at where we are here in Wales. We have over 700,000 patient pathways still waiting for treatment. Staggeringly, healthy life expectancy dropped here in Wales in the last 3 years. Amongst surveyed staff, 57% struggle to switch off after work in the NHS and social care sectors, and stillbirth rates in Wales remain the highest in the UK. So there is root and branch need for us to look at, and this is what you're going to hear, how we switch from reactive to proactive. The Welsh Liberal Democrats have focused relentlessly on social care. And we've been honest about how that can be funded as well. If we can't get the funds into social care that we need to get people out of hospital and to keep them out of hospital, keep them out of going into hospital, then we need to look at whether we put a penny on income tax. We're being honest with people for a fixed period of time. Right now, there are 1,000 people, over 1,000 people in beds, in hospitals in Wales who need to leave, and they can't because of social care. Couple of other things. We need more funding going into arts, social care and sports. That's about prevention. We want to see our care staff and our NHS staff treated well, paid well. I've been a social worker for 25 years before I came into politics. My husband still works in a hospital. There are real challenges around morale and self-esteem, and we need to support our staff. And finally, we need preventative screening to be in place for conditions like diabetes. I also want to see things like hearing aids to be in place for older people to ensure that we prevent dementia. There needs to be we need to grab fantastic ideas from across the world and put them into our Welsh NHS and social care sector. Diolch yn fawr iawn.
Thank you, Jane. And our fifth speaker is Mabon ap Gwynfor, Plaid Cymru Health Spokesman. Thank you, Mabon.
We often look at the past through a sepia-coloured lens, but when it comes to health and care, the uncomfortable truth is that outcomes were better not that long ago. 15 years ago, the NHS in Wales was ranked amongst the very best in the world, and that wasn't by accident. The NHS was founded not just to treat illness, but to prevent it. And it's no coincidence that Aneurin Bevan served as Minister for Health and Housing. He understood that your job, your income, and the quality of your home shape your health long before you ever see a doctor. Today, we're drifting away from that founding vision. The NHS risks becoming a national hospital service, reactive, overstretched, and focused on crisis rather than prevention. If we want to secure its future, we must go upstream, investing seriously in prevention, strengthening primary care and properly valuing social care as an equal partner, not an afterthought. We don't fix a system under pressure by applying sticking plasters. We fix it by designing it around keeping people well. Too often we've slipped into learned helplessness, managing decline rather than leading change, accepting that this is simply as good as it gets, debating structures instead of asking the deeper question, what kind of system do we actually want to build? So this isn't as good as it gets, and it doesn't have to be this way. We improve by listening, by truly listening to patients, to clinicians, managers and carers. We improve by tackling root causes, not layering reform upon reform. And we improve by building a culture willing to take on responsibility, cooperate with others and solve problems together. That means valuing the workforce with a serious long-term plan, clear accountability, better use of data, stronger partnerships between health boards, local authorities and the third sector, and a proper focus on digital tools, on primary care, social care and the wider determinants of health. Not to hit arbitrary targets, but to improve outcomes, restore dignity and help people live full and independent lives. But let me be honest, no one can transform the health and care service in Wales in a single 4-year term. Anyone who says that they can is not being serious. But within 4 years, we can change the direction. We can lay the foundations and we can restore the belief that improvement is possible. Building a truly integrated national health and care service will take time, honesty and partnership across political lines and across the sectors. That's the long-term project that we have before us, and if we work together, we can achieve it.
Thank you, Mabon. And our last speaker this morning is Peter Fox, MS, on behalf of the Welsh Conservative Party. Thank you, Peter.
Yeah, thank you, Jonathan. Good morning, all, and it's a pleasure to be with you. So I want to start really by recognising the hard work being done across our health and social care system. I know you all are working under sustained pressure, and I think it's important to say clearly that the challenges we see in the system are not a reflection of a lack of commitment from staff. But we have to be honest, our health system is under real strain. Waiting times, demand and workforce pressures are significant, and we know that many in the system are operating under additional scrutiny and intervention. The Welsh Conservatives' first priority is to stabilise and support the system. Now, we declare a health emergency, and that's to bring focus and urgency, but also coordination. We want to improve patient flow by reopening appropriate capacity where possible and ensuring patients are cared for in the right place and at the right time. Alongside that, we are focused on supporting and growing the workforce in line with a robust workforce strategy, because recruitment matters, but so does retention, morale and leadership. We need to reduce reliance on agency staff. We need to invest in training and make sure workforce planning is long-term and aligned to real demand. We know this can't happen overnight, but it's fundamental. Our second priority is modernisation. There is a huge opportunity in digital and data, not to add pressure, but to improve the system. Better communication, fewer duplicated processes, and giving clinicians more time with patients must be something we strive for. That's where Digital Health Wales and partners have a crucial role to play. Sadly, though, through my committee work, I hear too often about the lack of accessible data or systems that just don't join up. Third priority we need to shift for is, as we've heard from other speakers, and that's prevention and community-based care. Strengthening primary care, expanding the role of pharmacies and improving early intervention will not only improve outcomes, but reduce avoidable pressure on hospitals. But there are barriers, especially where the money doesn't match the aspiration. Indeed, I see the gap widening between primary and secondary care when it needs to be the other way around. So we're committed to increasing investment in mental health services and improving access, particularly for those in crisis and for young people. We all know a sustainable NHS depends on a stronger social care system. Better pay, better integration and a long-term reform are essential, not just for social care itself, but for the effective functioning of the NHS. And finally, we must recognise the role of unpaid carers. They are not separate from the system, they are part of it. That means supporting them with respite, practical help and treating them as partners in care. Underpinning all I've said is a commitment to clear accountability, transparency and learning to support improvement and restore confidence. Diolch.
Peter, thank you very much indeed. Can I thank all 6 of our party political representatives for being able to be here this morning to put their pitch to you. We've now hit more than 70 people in the room, which is fantastic, and really good to see so many people joining this event this morning. I am going to throw it open to questions as people are mulling over the question they might want to ask. And before I come to Ruth, who's been very quick on the buzzer to get the first hand up. So my colleague Ruth is the interim chair at Digital Healthcare Wales. Before I come to Ruth, I just wanted to ask a very quick question on social care. A number of you mentioned social care and the range of activity that takes place outside of the NHS and the impact of the health and social care system in totality is, of course, something that we need to understand more about. So for those of you who see the future of social care, what does that future look like? What are the challenges in social care that you think need reform and change? I don't know if anybody wants to go first. Anthony, I'll come to you first, actually, because you were the first one to mention social care. How's that? Oh, you're on mute, Anthony. Sorry. You're on mute. There we are. Perfect.
I think by now we'd know how to do this. Yes, thanks, Liz. Yeah, as I mentioned, we've got a whole range of policies around us looking at how we integrate social care, because it is so important, it's so crucial. And by integration, we mean clearer planning, better data sharing, fairer funding mechanisms, as I said, not simply moving social care into health boards. And we need to look at expanding pooled budgets, reducing fragmented top-down grant funding, all together really looking at more joined up systems, and also how we can involve community social enterprises and cooperatives to help deliver some of this as well. And this integration needs to take place, as I said, absolutely at that community level, but also working with people who are tackling poverty, housing, and education, those sort of things that feed into this. And we need to get better specialist support for startup and ongoing development of community social enterprises. And we'd like to look at introducing legislation to support community ownership of some of these organisations as well. And exploring pilot programmes in one area to try and find out what works best, tackling acute shortages. But fundamentally, it is recognising the important role of social care. And as has just been mentioned, the work done by unpaid carers is crucial, and that has to be addressed as well. And it's again coming back to prevention being the organising principle of our health policies. So we want to see implementation of the prevention-based health and care framework, identifying the fundamental components needed to shift the health and care system. So we are talking about a fundamental shift in how we approach these issues, and that joined up approach, seeing things in the whole, is very much part of overall Green Party policy. Thank you.
Thanks, Anthony. And Calum, I'll come to you next. Thank you. I'll do it in the order in which you spoke earlier, which is probably the fairest way around of doing it. Thank you.
Great, thanks, Jonathan. Yeah, for me, it's looking at the overall funding. Social care is obviously delivered through local government, and we talk about health funding often and the increases in health funding that are needed. And there's some political risk sometimes in putting more money into social care rather than health, because you get attacked for not investing enough in health. And that's something we've historically seen in Wales. I think we need to look, and all this applies to all parties, including my own, that we need to look at the pot for social care as part of the wider health system, and that is preventative, as has been said already. And that means then that, if you're looking at it as a whole, you're not going to get those arguments between different budget holders around who's paying for what. That does happen. We know that patients, interface between social care and health. They find it very difficult to navigate the funding, and then when they start to be charged for health and social care services rather than health. But also local government, are obviously under pressure to fund lots of services, and the social care budget is the one that's really putting the pressure on to their budgets overall. So we need to have that conversation with local government leaders, WLGA, and look at that investment in its totality. The other thing I would say is, there are workforce issues as well in health and social care. So parity between the two sectors is an important thing. So we want to make social care somewhere where people want to go work and don't feel that they're going to get paid less for the same amount of work. It is skilled work. And we need to make sure that those people are paid fairly, which the Labour Party has focused on in its last term. And I think we need to do more on that. Diolch.
Thank you, Calum. James, I'll come back to you now as well. You mentioned social care specifically, of course, the step down challenge sometimes out of hospital. So what do you think the big challenges are?
Well, it's right to raise it because I think it's the biggest pressure point across the NHS is social care. And at the moment, I believe it sits as a bit of a no man's land between health boards and local authorities. And when it doesn't work, it is patients. They're the ones who are stuck in hospitals or waiting an ambulance because there's physically nowhere for them to go. So what I'd like to see is more joined up with a clear costed framework, so everyone knows who is responsible, how it works, that closer integration between health and social care. And you mentioned there, we need more step down and intermediate care facilities so people can leave hospitals safely. And when they're ready, they don't need to be in the acute beds all the time. If they can go to a community setting where they can just get a bit fitter, back ready to go home, that stops the revolving door of people being discharged early. They go home, they fall because there's no care package in place, or they've had no adaptations to their home, and the roundabout comes round again and back into the system. So that needs to be addressed. And as I said earlier, I want the system to be sustainable. And we've got to put more focus on resource into social care and primary care, because if that's what stops people ending up in hospital in the first place. But on the workforce element, I do think we need to make sure there's proper pay and progression for social care workers. That's something that I hear an awful lot of the time, is they don't feel valued for the work they do. And I think they're holding up the NHS in a lot of time as well, some of the people in social care. And actually they need to be paid and have proper career progression in their jobs as well, because I think they've had platitudes for long enough. It's actually time for the real change that they need, because saying good things is very lovely to the social care staff, but actually it's about time we deliver the change that they really need. Yeah, thank you, Jonathan.
Thank you, James. Jane, thank you very much. I'll come to you next.
Yeah, diolch yn fawr iawn. Well, we're very